Okay, continuing on with the hand, wrist, finger anatomy. Now looking at the first carpometacarpal joint. So this is going to be down where the carpals meet the metacarpals. The first metacarpal joint, which is the thumb, is a carpometacarpal joint, is a little bit different than the other four. If you look at the trapezium, the carpal bone that articulates with the first metacarpal, we consider this a saddle-shaped joint. And if we look at the individual bones in lab, you can kind of see that the trapezium has a lot of these projections and kind of these awkward shapes. And this articulation, the way that it has this saddle shape structure here, is going to accept the end of the first metacarpal really nicely, and because of the joint makeup, it's going to end up having 2 degrees of freedom instead of 1 degree of freedom. When we look at the other carpometacarpal joints, the articulation only allows for flexion and extension to occur. But in the thumb, the first carpometacarpal joint, because of the articulation and how it's formed, we have 2 degrees of freedom, so we're able to do abduction and adduction and flexion and extension. Opposition is also a range of motion that we do use for the first carpometacarpal joint. And it's going to allow our thumb to go over and touch our pinky or each of the other 4 fingers. Opposition is really a combination movement of flexion and abduction, so it's kind of like circumduction in the shoulder, where we talk about it as a movement, but it's not really considered a movement in the plane. That's why it's not considered there's not 3 degrees of freedom, there's only 2. But because we can combine flexion and abduction, we are able to do opposition. So there are flexion, extension, abduction, adduction, and opposition. The opposite of opposition is reposition. So those are the movements that we do have at the first carpometacarpal joint. So not up at the actual phalange, but down where the carpal meets the metacarpal. So I put this video in. Let's see if I can get it to play. Okay, so like I said, this is about the first carpometacarpal joint, so that's going to be down here. The scaphoid is in the snuff box, then we have the trapezium, and the trapezium articulates with the first metacarpal. So we're not talking about the thumb and the phalange itself, we're talking about what's the movement going on down at the wrist area where the carpometacarpal joint is. When you look at the thumb, the reason that these motions in the pictures can be kind of confusing, and why I recorded my own hand here, is because your thumb, when you look at it, your thumb is not sitting in the same plane as the rest of your hand is. When your hand is at rest, your thumb kind of is rotating around, so it's more difficult to see in a 2D picture. So the reason I recorded this is because I really wanted you to see that because the thumb is kind of sitting in its own plane, you really want to, when you look at these motions here, basically palpate and feel here and see what's going on. So our goal is to look at this first carpometacarpal joint right here, and that's going to be flexion, and then coming back is extension. Then we're going to have, again, starting from here, we have abduction and adduction. So AD is back toward the hands, and then we're over here to opposition. Opposition is going to be where we kind of rotate around and have that thumb go over and touch the pinky. So then the other 4 carpometacarpal joints are pretty straightforward. For the joints 2 through 4, which are the main 4 fingers, there's only 1 degree of freedom. So based on their articulation and the way that the bones are aligned, they're only able to do flexion and extension. And the overall movement of these joints are very small. The 5th carpometacarpal joint is the pinky, and that one, because of how our pinky has to come around and do opposition, that one actually does have 2 degrees of freedom. We are able to have some abduction, adduction at the carpometacarpal joint. Again, down here, more close to the wrist versus up in the fingers. We're not talking about the phalanges here. We're talking about the wrist. So I said it wrong the first time. 2 through 4 is the 2, 3, and 4 right here have just flexion and extension. your pinky is going to have abduction. So the pinky and the thumb have 2 degrees of freedom. The other 3 fingers only have 1 degree of freedom. The second and third carpal metacarpal joints, so second and third right here, they're practically immobile. I mean, we do say they have flexion and extension, but really during most motions, based on where they're at and what those fingers do and the metacarpals do, there really is not a lot of motion there. The fourth and fifth, as we get to the pinky and ring finger, they're going to have a little bit more mobility, and we need to have that so that we can actually grip small objects. If we didn't have more mobility in those 2 joints, then we wouldn't be able to have a very strong grip on small objects in your hand. Okay, so now moving out to the metacarpal phalangeal joint. So metacarpal phalangeal, we're looking at these joints out here. So where the metacarpals meet the phalanges, the metacarpals meet the proximal phalanx of the phalanges. And I put this x-ray up here because you can really see how the convex-concave anatomical structure of these joints. So the actual metacarpal itself is going to be round on the top, and that's going to be our convex surface, where the proximal phalanx, the bottom part of that, is going to have a concave surface. So we have a convex going into a concave, and again, you can see that on all these pictures. In the metacarpal phalangeal joint, in all the joints, we are able to do flexion and extension of the metacarpal phalangeal. So again, that's occurring at these joints right here. And we also have abduction, adduction, and this includes the thumb as well. So on the video, on the next slide, I put that on there because I think it's just interesting, where we do have a fair amount, when your metacarpal phalangeal joints are in extension, you have a fair amount of abduction and adduction. You're able to spread your fingers far apart. In the video, I'll show you that when your metacarpal phalangeal joints are in flexion and then you try to abduct, you're not really able to. So you have very limited abduction when you are in, when your second through fifth phalanges are in flexion. So that's what I'm showing here in this video. So here's our normal abduction. You're able to get a lot, adduction. But then if we flex our metacarpal phalangeal joint and then try to do abduction, you're not really able to pull your fingers apart. But then if you go back into extension, you are able to get that full abduction. Okay, then the actual interphalangeal joints themselves are going to have just 1 degree of freedom. We are only able to do flexion extension at all of our interphalangeal joints. So that is on the thumb. Remember that it's just, there's only 2 bones. We have a distal and a proximal phalanx. So we only call this one just the regular interphalangeal joint. In the other 4 phalanges, there are 3 bones: the proximal, the middle, and the distal phalanx. Because we have 3 bones, that means there's going to be 2 joints, and we call those joints the proximal interphalangeal joint and the distal interphalangeal joint. But again, based on their anatomical makeup, we are only able to do flexion and extension of those joints. Just looking at the ligaments around the phalanges and up in the hand a little bit, moving away from the wrist. All of our metacarpal phalangeal joints and all of our interphalangeal joints are going to have collateral ligaments. These collateral ligaments, just like we would, talk about the ulnar collateral ligaments and the radial collateral ligaments and the medial and the lateral collateral ligaments in the knee, collateral is just going to mean on the side. So each one of these joints is going to have 1 ligament on each side called a collateral ligament. We can call them medial and lateral, but more commonly they're going to be called radial and ulnar collateral ligaments of that specific joint. And this is where the names of things start to get very long, because I could say I have a sprain to the ulnar collateral ligament of the proximal interphalangeal joint of the 4th finger, and that is all the descriptor to say where this injury is at. So it starts to get very long, but you have to be as specific as possible. All these collateral ligaments are going to run at an angle, so they're not running straight across. They actually run at an angle. They're going to start more on the dorsal surface or the back side of the hand or that individual bone, and they're going to run at an angle and insert on the proximal bone next to it. So they do run from dorsal to palmar side. And their primary job is to resist that valgus and varus force depending on what side they're on. This is where it also gets confusing because the hand is usually, supination, pronation. Make sure that you understand that you have to move back to anatomical position. So if you're trying to figure out, first of all, which ligament is injured, and then you have to figure out if it's a valgus or varus force, because we're going to learn valgus and varus stress tests of each one of these collateral ligaments. Looking at these a little bit closer, as the finger flexes, these collateral ligaments are going to tighten and limit the amounts of overall abduction, adduction that are allowed to happen at that joint. Now these joints are not actively able to do abduction, adduction, but if you apply a valgus or varus force, then those individual bones will move. But again, we can't do it actively. So when we're in full extension, so in this picture up here, we're looking at one of the interphalangeal joints, and when we're in full extension, these collateral ligaments, they have some slack in them. They're not all the way taut. As we go into flexion, though, then we see that they become very taut. So as we go into flexion, the collateral ligaments become taut. When we're extension, they're a little bit looser, and we need more stability when we are moving into flexion, because then when you're moving into flexion, you tend to be actually using those joints, and if you're actually using them, forces are being applied, and that's when you're more prone to injury. We also have things called palmar ligaments or palmar plates, or also called volar plates. These are all, obviously because it's palmar, going to be located on the palmar side of each one of the metacarpal phalangeal joints and each of the individual interphalangeal joints. So these are basically just thick fibrocartilage plates that are located, this is a palmar view, that are located on the palmar surface of each of these individual joints. So here, 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 all the way out. And they're responsible for limiting too much extension. We have a lot of flexion in our fingers, but basically for the majority of people, full extension is basically just straight. So this is going to help us limit hyperextension and add stability to prevent against too much hyperextension. Then we also have transverse metacarpal ligaments. Transverse metacarpal ligaments are going to be at the very top of those metacarpals. So they're actually at the metacarpal phalangeal joint, and these are the ones that are going to be in between each metacarpal. The thumb is not included because it's its own thing, but of the 4 fingers, so each one of these in here is going to be a transverse metacarpal ligament. They're responsible for limiting how much, basically, abduction that we have at those joints, because based on where they're at, that's the very top of our palm. We don't want too much motion there because that's going to end up tearing things. So they're there to keep these bones in alignment and prevent too much abduction, and also help reinforce the palmar plates.